Welcome to MS Minute with DC&D, your podcast for understanding multiple sclerosis. Every month, our MS experts tackle a different topic to help you manage your disease and live a better life. DC&D is a private neurology practice based out of Dayton, Ohio. It's certified by the National MS Society as a comprehensive MS care center. Please note this podcast and its content is designed for educational and informational purposes only.
Welcome to MS Minute with DC&D. As always, thank you for joining us. I am your host, Natalie Pugar. There are so many different therapies available right now to treat multiple sclerosis. Some are oral medications, some are injectables, and some are infused. In this episode, we are going to be talking specifically about what that infusion process looks like. Joining us today is infusion nurse Jen Fiorita. She helps patients daily with their infused medications. Welcome, Jen.
Thank you. Thanks for having me.
Thanks for sharing your insight with us today. So the whole point of an infused drug is to get the medication directly into your bloodstream faster, right?
Yes.
Okay. Can you explain a little bit about what goes on during an infusion?
So the IV medication, as you said, goes directly into the bloodstream. There are many different kinds of MS medications out there right now, injectables, orals, IV infusions. The discussion with your physician on the pros and cons of all of these will really be related to your specific MS disease course, symptoms, how things have gone for you overall with your MS. So if they decide to do an infusion medication, you will come see us here in Infusion.
Very nice. Okay, so let's talk about these infusions a little deeper. Typically, you said where they're done and how long do they last?
Typically, you'll have your infusions done either in a hospital or an outpatient setting. Our infusion center at our Beaver Creek office is considered an outpatient infusion center, and it is at our physician's office.
Okay, so real easy for a patient to do.
Correct. Yep.
Yeah, they don't make it complicated, and it's a nice environment.
Very nice environment. We're up to 9 chairs now, and very homey environment to come in and get your infusion done.
So walk us through like a step by step when a patient comes in, what's their experience like? What are some tips that you have for them?
Sure. First time coming in, usually we will first sit down with you and just kind of do some education regarding your treatment. What you're receiving, any possible side effects, pre-treatments that we'll give prior to your infusion. We usually screen for any illnesses or infections, answer any questions that you have, usually do a quick assessment, take some vital signs, and then we would start your IV. After the IV started, we would give any pre-treats that you may need prior to that infusion, and then we would get started with your infusion. There's sometimes an observation time after infusion, usually an hour, and then we would just discharge you with instructions and when to call us for the next time.
Okay. I could assume that some patients kind of get a little weary about this, might be a little scared kind of going into this for their first time. Can you speak to the pain level, some patients experience and if they've had any after effects or side effects because of stuff?
Sure. That first initial IV start maybe would be the most painful thing, but most patients tolerate it really well and don't have an issue. There is a needle, obviously, when we start the IV. When we place the catheter, it's placed with a needle, so that part can be a little painful for patients, but like I said, usually they do really well with it. Once that IV catheter is placed, the needle's removed and the infusion is started. So usually after that initial stick, patients are fine.
Okay, good. So pretty much it's just like an IV that you would get at the hospital.
Correct.
Like you said.
Yep.
Okay, perfect.
Yep.
So, and then, it's most of a kind of you just sit back and let it do its job.
Absolutely. Usually infusing from 1 to 4 hours, depending on which treatment you're on. Afterwards, some patients will feel a little run down or tired. Some of that is from the medication they're receiving. Some of that can be from the pre-treatments we give. So one of the pre-treats, Benadryl can make patients feel kind of sleepy or hungover for some of the part of that day. Usually, though, the next day, 2 days, patients are feeling back to their normal selves.
Gotcha. Okay. What other tips do you have for somebody who's kind of going through this experience, maybe for their first time?
I would always, a couple that I always will tell patients is to please let us know if you've recently been ill, had any active infections, if you're undergoing any treatments with another physician, been hospitalized. Some of these medications can't be given if you're actively sick or with an infection, so always tell the patients to call ahead if there's anything like that going on. So that we can get with the doctor and just make sure that it's appropriate for you to still get your treatment. The other one is please hydrate.
Easier to find those veins, huh?
Yes, starting a couple days ahead of time, I usually will ask patients to really hydrate so that we have an easier time getting that IV started. As far as other medications prior to coming in, you are fine to continue all of your normal medications. So if you're on blood pressure meds or blood sugar medications, we do encourage you to go ahead and take those on the morning of your infusion. We also tell patients to please let us know regarding vaccinations, because some of these medications affect the way the vaccinations work, so we kind of have to time them up when they can get those vaccinations. So to always call in and ask prior to getting any vaccination or immunization. And then, as I said before, to please don't wait till the day of infusion to address any new issues or problems, to call in during the month or whenever you're having those issues and let us know right away so we can get with the doctor.
Yeah. So you work really closely with the patient's doctor.
Absolutely. Yep.
Got it. So a lot of these medications, these infused medications for MS can be really expensive. And I know insurance plays a big part in that. And so do you. So can you speak a little bit of how that whole process works? So once they go to the doctor has, said, okay, we're going to try you maybe on this infused medicine. What's that next step?
Sure, absolutely. So typically there's a start form that you will complete when you're in the office with the physician. After completing that start form, it kind of starts a whole cascade of things and different people that are involved. So it goes to the drug company, as well as information has to go to the insurance company, obviously. And because these drugs are expensive, certainly we do get some pushback from insurance companies quite frequently on covering these medications. So just kind of want to let patients know, unfortunately, this process isn't usually as quick as they would like. I usually tell patients for an authorization from your insurance can take anywhere from 15 to 30 days to complete. And then we also look at the financial assistance portion of that. So there's a lot of plans with these drugs that offer financial assistance to patients. So we try to get you set up with that so your out-of-pocket cost isn't going to be as large. But it is a process. You can certainly reach out to us anytime for kind of updates on where we are with things. But please know we are working behind the scenes, even though you may not be hearing from us, trying to get things approved and roll in for your infusion. Another just little tip on that, sometimes there are lab work that needs to be completed, and I have to have all of that done to be able to send to the insurance company for your authorization. So I find that that's one area where we get kind of hung up sometimes, is the doctor's ordered labs and they haven't been done yet. And I can't start the process with the insurance company until I have the labs to send with our information to them. So if labs are ordered at your visit when you fill out your start forms, I would just encourage patients to make sure they're getting those done as quickly as possible so the process can go.
Great advice.
Yeah.
And I know that a lot of drug companies also have their own like support lines and things like that for those questions and maybe some financial assistant questions.
Yep, they will. Usually these drug companies are reaching out. As I said, we have to send these start forms to them as well. So they usually will start reaching out to the patient as well regarding some of the financial assistance stuff. It can be very confusing because you're getting a lot of calls from different places. But if you ever have questions, you can call me and I can kind of walk through and help you with that process as well.
Great. Okay. Well, tell us that, the other thing we've heard from several MS patients who've talked to us on this podcast has been kind of the infusion area has been a place of camaraderie, of a place of like almost a support group for some, specifically for MS, because you kind of lean on those people and you're all in the same situation and you can talk to people that you might never have met before, but right, down the way in a new seat. Can you speak to any of that and what you've seen?
Absolutely. So many of my patients here are getting treatment for MS, which sets up a great environment to meet people and to be able to speak with others that are going through a lot of the same things that you may be experiencing as far as symptom-wise. They may be on the same medication that you're on, and I've had people become friends. They hang out outside of infusions. Sometimes they schedule their infusions on the same days and sit and socialize the whole time they're here. I even had a couple that met here that got married. So
that is incredible. Wow. Guys, see, you never know who you're going to meet in your infusion. But that's cool. I mean, why do you think that is?
I think that it's really important for patients to be able to feel like someone hears them and understands kind of what they're going through as much as their friends and family or support at home. I think being able to talk to someone else that kind of gets it makes a big difference to patients, and they find it really enjoyable a lot of times to be in here and be able to sit and talk with each other about it, vent and share stories.
Yes.
Yeah.
So important for our mental health too. Absolutely. So any parting words of wisdom that you would have, as somebody who sits with these patients for hours every week, what's your parting words of wisdom to them?
So it can be very nerve-wracking for a lot of my patients when they first come in as first infusion patients. Please know you can call us anytime prior to infusion. I will answer any questions that you have regarding the process. Usually people do very, very well and leave feeling upset, I guess, that they were even nervous about it to begin with. So
good. Most
people do really well. But any questions, please reach out to us anytime. We are available to speak about the medications, the infusion process. We are always available.
Okay, perfect. Thank you so much for your insight on all this.
Absolutely. You're welcome. Thanks for having me.
All right. As always, you can find more information on our website at dcndinc.com. See you next month.